Good morning, everybody. Today we are going to discuss pericardial sinuses. The learning objectives for my today's lecture are: in this lecture, I will describe transverse and oblique sinuses of the pericardium. What is pericardium? Pericardium is a fibrous sac surrounding heart and roots of great vessels. It has two layers. Outer layer is called fibrous pericardium and inner layer is serous pericardium. Serous pericardium is further divided into two layers: outer parietal layer which lines the fibrous pericardium from within, and inner visceral layer which lines the heart. The two layers are continuous at the root of great vessels. Between the two layers is a fluid-filled space called pericardial cavity. As shown in this figure, heart is enclosed in fibrous pericardium. Fibrous pericardium is lined inside by serous pericardium, which has got two layers. The inner layer lines the heart and the outer layer lines the inner surface of fibrous pericardium. These two layers are continuous with each other around the roots of great vessels. A narrow fluid-filled space between these two layers is called the pericardial cavity. There are two sinuses bounded by left atrium, great vessels, and pericardium. These sinus develop during the folding of embryonic heart. They are named as transverse and oblique sinus. The two sinuses are not continuous with each other. Both sinuses open within pericardial cavity. Transverse sinus is important in cardiovascular surgery. Some authorities consider that oblique sinus is very important physiologically. As you know, heart is enclosed in fibrous pericardium. If we give an incision or nick in the fibrous pericardium, what we see inside is heart contained within the fibrous pericardium as shown in this slide. Both heart and pericardium are located in middle mediastinum. To understand the orientation of the pericardium and heart within mediastinum, let us go to this slide. On the left side of this slide, we find that heart and pericardium both are contained in the middle mediastinum. If we give an incision in the middle mediastinum as shown by this yellow dotted line, we open the pericardium, and inside the pericardium we find sternocostal surface of the heart. If we give an incision anteriorly, we find inside the pericardium is sternocostal surface of the heart, roots of the great vessels. Now if we give a nick posteriorly, we see inside the pericardium is base of the heart, roots of great vessels, and also see the pulmonary vein is opening inside the heart. Now let us go to this wet specimen. What do you see there? Again, we see sternocostal surface of the heart. This glistening membrane is in fact the pericardium which has been cut. We see there are roots of great vessels, ascending aorta and pulmonary trunk. These things we can see if we give an incision in the pericardium anteriorly. We can also see superior vena cava opening into right atrium. To understand the anatomy of transverse sinus, let us go to this wet specimen. What do you see in this wet specimen? In this specimen, you will find index finger between anteriorly located ascending aorta and pulmonary trunk and posteriorly located superior vena cava. Now, this sinus of the pericardium, which is bounded anteriorly by ascending aorta and pulmonary trunk and posteriorly by inferior vena cava, is called transverse sinus of heart. Inferiorly, this finger rests on the left atrium. This sinus opens both on the right and left sides into pericardial cavity. Now, if we pass a forceps between the aorta and pulmonary trunk anteriorly and superior vena cava posteriorly, this forceps again lies in the transverse sinus, and this sinus you can again see it opens inside pericardial cavity. So what are the boundaries of transverse sinus? The transverse sinus is a tunnel-shaped passage posterior to the aorta and pulmonary trunk. It lies anterior to the superior vena cava, and below the transverse sinus is left atrium. So the boundaries of transverse sinus are anteriorly aorta and pulmonary trunk, posteriorly superior vena cava, and inferiorly left atrium. What are the communications of transverse sinus? As shown in this diagram, this transverse sinus is a tunnel shaped which is open on the right side as well as on the left side, but on both sides it opens inside pericardial cavity. It communicates with the main pericardial cavity at its right and left ends. It separates arterial and venous ends of the heart. It separates arterial vessels, that is aorta and pulmonary trunk, from venous vessels, that is superior vena cava and pulmonary veins. Development of transverse sinus. Transverse sinus develops during the folding of embryonic heart between arterial and venous ends of heart tube. It separates arterial end, which is composed of aorta and pulmonary trunk, from venous vessels, that is from superior vena cava and pulmonary veins. Now, what is the clinical importance of transverse sinus? These sinus is important in cardiovascular surgery. If we pass one end of a clamp through the sinus and the other end anterior to the aorta and pulmonary trunk, it will allow complete blockage of blood flow from the heart. So transverse sinus is a horizontal gap between the arterial ends of the heart tubes in front and venous ends behind. Anterior there is aorta and pulmonary trunk. At posterior there is superior vena cava. On each side it opens into pericardial cavity. What is oblique sinus? After giving an incision in the pericardium, if we lift the apex of the heart, posterior to left atrium lies oblique sinus as shown by this black arrow. Now what is oblique sinus? It is a U-shaped blood recess which lies posterior to left atrium and can be entered inferiorly. It is produced by reflection of pericardium onto the pulmonary veins and inferior vena cava. It is bounded anteriorly by left atrium, posteriorly by pericardium. Below it opens into pericardial cavity. Now let us go to this wet specimen for understanding gross anatomy and topography of oblique sinus. The first question which I would like to ask all of you is, where is oblique sinus located? The answer is very simple. It lies posterior to the heart in the pericardial sac. To understand the gross anatomy and topography of the pericardial sinus, give an incision in the pericardium. Lift the apex of the heart with one hand. Place fingers of the other hand posterior to the heart within pericardial cavity to locate the oblique sinus. As shown in this diagram, left hand has been put inside pericardial cavity. It lies posterior to the heart. Palmar surface of the fingers are touching left atrium and the dorsal surface of the testis are in contact with the fibrous pericardium posteriorly. On the right side, these fingers are bounded by superior vena cava, inferior vena cava, and right pulmonary veins. On the left side of these digits are right or left pulmonary veins. So the tips of fingers are in the pericardial cavity. Location. As shown in this diagram, palmar aspect of the fingers are in contact with the left atrium. Dorsal surface of the testis touch the pericardium. On the right side, there are right pulmonary veins. On the left side, there are left pulmonary veins. Superiorly, tips of the fingers are bounded by reflections of the pericardium. Inferiorly, this U-shaped sinus is open. Now, heart has been taken out of the pericardial cavity. In other words, anterior wall consisting of the left atrium has been removed. So posteriorly, there is pericardium. On the right side, there is superior vena cava, right pulmonary veins, and inferior vena cava. On the left side, oblique sinus is bounded by left pulmonary veins. So this U-shaped recess represents the oblique sinus as shown by this black arrow. So its boundaries are anteriorly left atrium, posteriorly pericardium. On the right side, superior and inferior vena cava, in addition to right pulmonary veins, and on the left side, there are two pulmonary veins. So the boundaries of oblique sinus are, on the right side it is bounded by lines of reflection onto inferior vena cava and right pulmonary veins. On the left side, it is bounded only by lines of reflection onto left pulmonary veins. So anteriorly, there is left atrium, posteriorly pericardium. On the right side, superior vena cava, inferior vena cava, and right pulmonary veins. And on the left side, there are only pulmonary veins. What are functions of oblique sinus of pericardium? It is also called cardiac bursa. It is akin to lesser sac supporting the stomach. It develops as a result of absorption of four pulmonary veins into left atrium. It permits distension of left atrium during return of blood from lungs. Some authorities believe that it has no role at all. So I want to summarize my lecture as two pericardial sinuses are oblique sinus and transverse sinus. They are formed during folding of embryonic heart. Transverse sinus is bounded anteriorly by aorta and pulmonary trunk and posteriorly by superior vena cava. These sinus may be used for ligation of aorta and pulmonary trunk during cardiac surgeries. Oblique sinus is a cul-de-sac lying posterior to the left atrium and it opens inferiorly. It is also called cardiac bursa, may facilitate distension of the left atrium during diastole.
Do not forget to subscribe my channel. Press on the bell icon to remain updated about more video uploads.
Now let us go for a quiz based on this mini lecture. Which of the following statements is false about transverse sinus? A. Openness within pericardial cavity. B. Bounded anteriorly by aorta and pulmonary trunk. C. It is bounded posteriorly by inferior vena cava. D. May be used for ligation of aorta and pulmonary trunk. So C is the wrong option. It is bounded posteriorly by superior vena cava, not by inferior vena cava. Which of the following statements is false about oblique sinus? A. Openness within pericardial cavity. B. Bounded anteriorly by left atrium. C. Bounded posteriorly by the pericardium. D. Communicates with transverse sinus. D is the wrong option. The two pericardial sinuses do not communicate with each other. False statement about oblique sinuses is in the form of cul-de-sac which opens superiorly into pericardial cavity. B. Or it is also called cardiac bursa. C. Its role is controversial. D. Does not communicate with transverse sinus. So A is the wrong option. It is in the form of a cul-de-sac and opens inferiorly into pericardial cavity. False statement about oblique sinuses is in the form of a cul-de-sac which opens inferiorly. B is also called cardiac bursa. C. It opens inferiorly in pericardial cavity. D. Left ventricle forms its anterior boundary. D is the wrong option. It is in fact the left atrium which forms its anterior boundary, not the left ventricle. Do not forget to like, subscribe and share this video. Thank you for watching.